Today you will learn about the assessment process as a part of the SPF model, or the Strategic Prevention Framework. Hello and welcome everyone. My name is Johnny Lang and I am a Community Support Specialist at DECA. In the multi-stage process of assessment, your community will prioritize community problems, factors influencing the problems, as well as the community's capacity and readiness to strategically address each priority. As the first phase in a circular planning model, assessment will set the stage for future strategic prevention framework steps. This model will take you through portions of the assessment process that include understanding the needs and problems of your community, reviewing the resources that are required and available to address the identified problems, identifying the readiness of the community to address your prevention needs, as well as resource gaps. During this step, coalitions take stock of the problems or issues facing their community. They do this by gathering and analyzing data from a variety of sources. An assessment should answer the question, where is our community compared to our ideal view of our community? The answer comes from these questions. What? Asking the question what helps gain an accurate description and review of the problem behaviors that are happening in your community. Where and how? Asking the questions where and how helps determine where the behavior is occurring and the various environmental strategies and enhanced practices that can be employed to reduce opportunities for the problem to reoccur. But why? Following the determination of important patterns of use, communities will want to understand why these patterns are occurring by asking the question, but why? But why here? By understanding the influencing factors of the problem in our community, your coalition can then select effective strategies and initiatives by answering the question, but why here? Having clear and specific steps planned will allow your coalition to create and complete a needs assessment. This will help you identify the most appropriate and effective strategies to reduce the identified problems in your community. Assessment should assist in identifying and prioritizing the problems in your community as well as the impact of the problem. The data you gather may show what risk and protective factors are present in your community. Remember that the factors driving a problem in one community may differ from the factors in another community. Because every community is unique, it's important to determine which factors are contributing to problems in your community and address those specifically. Collecting the needed data is a great place to start with your assessment. There are different kinds of data that can be useful for assessment: quantitative and qualitative. Quantitative data answers how many and how often. It's typically described in numbers. It can be used to draw general conclusions about a population, such as the level of youth alcohol use in a community. There may be some gaps in the availability of quantitative data, which means it may be necessary to rely on qualitative data. Qualitative data explains why people behave or feel the way they do. Many communities use a combination of quantitative and qualitative data for their assessment. The methods are not so cut and dry. For example, surveys can give you both quantitative and qualitative data. Here are a few terms that will help you better understand the process you're about to begin: magnitude, trend, impact, and relative ratio. You will see these terms a great deal throughout the assessment process. Magnitude represents how many youth are impacted by the problem and what an acceptable level in your community would be. Trend explores whether the data points are increasing, decreasing, or remaining the same over time. Impact means the depth of the problem as assessed by multiple sources. And finally, relative ratio examines whether the most recent year of data in your community is higher, lower, or equal to the same activity in the state. Risk-focused prevention is based on a simple premise. To prevent a problem from happening, we need to identify the factors that increase the risk of that problem developing, and then find ways to reduce the risks. Risk and protective factors provide a necessary focus and structure for prevention. The Kansas Communities That Care Student Survey is administered annually by schools throughout the state. The data is used by agencies, schools, and communities in Kansas to monitor the prevalence of adolescent problem behaviors and the environmental factors that drive those behaviors. The KCTC survey is a free, essential resource for pertinent data and is strongly encouraged for schools to participate. Reference kctcdata.org for additional information. Each community is unique, and the accessibility of data in each community is also very unique. A coalition may inquire of its diverse members and partners to see what kinds of data they can bring to the table, such as health department data, law enforcement data, and other helpful information. The Kansas Behavioral Health Indicators Dashboard is another great source for local data. In addition to data collection from the coalition members, there are a variety of other ways that a coalition may gather information. This flowchart illustrates the process for assessment as the problem area is first identified. Next, the risk and protective factors that are driving this problem area are selected as a targeted, achievable change. Finally, the resources and readiness of the community is determined to best accomplish the selected problem area. Now that we've covered how to collect the data, we will begin to talk about how to assess the data. Thinking through a problem's impact takes into consideration both the effects the problem has on the community and helps to define the wider context and associated issues involved. When determining a problem's impact, it is helpful to think through the questions on the screen. After your coalition has prioritized the problem to be assessed in your community, you will then look at the factors that are driving the problem. Many factors influence the possibility that a person will or will not engage in problem behaviors. Effective prevention focuses on reducing those risk factors and strengthening protective factors that are most closely related to the problem being addressed. How might you know which factors to address? These questions can help you determine a factor's importance. How much does this factor contribute to our priority problem? Is this factor relevant given the developmental stage of our focus population? Is this factor associated with other behavioral health issues? Is this risk or protective factor changeable? Changeability describes a community's capacity to influence a specific risk or protective factor. These questions can help you determine a factor's changeability. Does a suitable intervention exist to address this factor? Can we produce outcomes within a reasonable time frame? And do we have the resources and readiness to address this factor? Other factors that need to be considered when prioritizing problem areas and influencing factors to address is the coalition's capacity and the community's readiness to engage in addressing the issues. How will you determine if your community has the resources and the readiness to address the prioritized problems and influencing factors? Data to assess the current capacity will need to be gathered. It's important to identify what the community currently has as resources, as well as what they might be missing. Through this process of determining needs and resources, there's also a great opportunity to develop relationships to improve the capacity of your coalition. Fiscal resources, which refers to the money that communities can bring to prevention efforts, as well as other things that cost money but can often be obtained for free. For example, grants, donations, office equipment, meeting space, etc. Human resources. That refers to the people who could assist with prevention in some way. For example, other staff members, consultants, stakeholders, etc. Organizational resources. This refers broadly to the structures within an organization and can include policies, resources, and missions that are deeply connected to a community's substance abuse prevention goals. Those might be vision and mission statements, other policies, etc. The Kansas Prevention Collaborative uses a coalition capacity survey tool to gather data. This survey can be taken online with a link sent out to coalition members. A survey link for this online survey can be obtained from your DECA Community Support Specialist. The survey is divided into sections that reflect multiple aspects of a coalition's capacity. These sections include vision, mission, and goals, projects, sense of community, communication, coalition meetings, membership participation, training needs, and management. The data collected from this or other similar surveys will give your coalition the information needed to identify strengths, weaknesses, and gaps. This is a very simple example of a survey to conduct with coalition members to determine everyone's assessment of the community. In addition to growing the capacity of your coalition, it's important to assess the community's readiness during this process. This can be accomplished by understanding what the community's current viewpoints are. If a community is not ready to address an issue, your efforts are less likely to succeed. By measuring the readiness level, actions can be taken to increase the readiness first, and interventions can be chosen to match the level of readiness and maximize success and positive outcomes. You will continue to assess the community's needs throughout the SPF process. This assessment is necessary to ensure that the community is working toward the appropriately identified risk factor so the overall goal can be accomplished. The Community Readiness Assessment is a tool that your coalition will complete, which will determine the scope of the resources and commitment of the community in tackling your identified problem behaviors. Public acceptance and support are necessary for ensuring the efforts of your coalition will be successful. We utilize the Tri-Ethnic Center Community Readiness Model to assess readiness in the community. More about this model is shared in the Capacity Building module. A logic model is a visual representation of your plan to create changes in your community. Logic models are helpful because they show how the elements of your plan work together and make it easy to see any gaps or inconsistencies. A complete logic model should do the following: identify the problems, identify the factors leading to the problems, provide a link between the identified problems and your coalition's actions, and provide measures for each question asked. It may be helpful to think of the logic model as a roadmap, which shows you where you are, where you're going, and how you'll get there. This next section will review your coalition's data. A logic model is a tool used to document and communicate the needs assessment and complete strategic plan. There are various forms of logic models. This slide represents a sample logic model. Part of every step of the strategic prevention framework are the concepts of cultural competence and sustainability. These two concepts should permeate each stage and help guide you in all areas of the process. Your coalition is the backbone of your prevention efforts and needs to be tended to. Working towards sustainability as you progress through each phase of the strategic prevention framework takes a lot of intentional effort, but is well worth it and can make all the difference in the success of your efforts. A needs assessment should answer one simple question: where is our community compared to our ideal view of the community? This question is best answered through a disciplined review of all available information in a community. Remember, community people solve community problems best. Here are a few links to resources that can help your coalition plan for assessment. There are additional e-learning modules that can be viewed to support your continued efforts to implement the SPF. Links for those resources are on the screen. Thank you for your time, and if you have any questions, please contact your DECA Community Support Specialist who can provide technical assistance or training.